Hi everybody, I am Dr. Pradeep Kumashan IC, consultant rheumatologist at Amrita Multi-Specialty Clinic, Attawar, Mangalore. This is the first rheumatology clinic of Dakshina Kannada and Udupi district. In this video, we will look into the mechanism of action of paracetamol and tramadol. Paracetamol has got analgesic and antipyretic effect, but it does not have anti-inflammatory effect. First, we will see why it does not have anti-inflammatory effect. For this, we will have to review the inflammatory cascade. Whenever there is a mechanical and chemical stimulus to the cell membrane, it activates phospholipase A2 enzyme. Phospholipase A2 acts on the phospholipids in the cell membrane. It produces arachidonic acid. Arachidonic acid is further acted upon by the cyclooxygenase and lipoxygenase. Lipoxygenase produces leukotrienes. Cyclooxygenase produces prostaglandins and leukotrienes. The prostaglandin G, which is first produced, is an intermediate and transient compound, which is immediately reduced to PGH by peroxidase enzyme. PGH is the direct precursor of PGI, that is prostacyclin, and other prostaglandins like PGD2, E2, and F2 alpha. These are the main chemical mediators of inflammation. When there is inflammation, cells produce a large amount of peroxidase enzyme, but paracetamol is not capable of inhibiting this large amount of peroxidase enzyme. That is why paracetamol does not have anti-inflammatory effect. Coming to the analgesic effect of paracetamol, it is well known that paracetamol affects its analgesic effects through central nervous system. Whenever there is a nociceptive signal to the cell membrane, the cell receptors carries it to the spinal cord via sensory nerve fibers. It ascends through the anterior horn of the spinal cord to the pain processing areas of the brain. In the brain, there is a descending system of serotonergic chemicals. This inhibits the pain perceived by the brain. So, serotonergic system is inhibitory to the pain perceived by the brain. Paracetamol stimulates the serotonergic nerve system, which inhibits the pain perceived by the brain. This is the mechanism of action of paracetamol on the analgesic effect. Now, coming to the metabolism of paracetamol, paracetamol is metabolized by liver into para-aminophenol. Para-aminophenol is carried to the brain and it is conjugated with arachidonic acid. The enzyme which mediates this conjugation is fatty acid amide hydrolase enzyme, and it forms an intermediate compound called as AM404. AM404 inhibits the synthesis of prostaglandin in the brain, which contributes to antipyretic effect of the paracetamol. It also inhibits the enzyme COX-3 in the cortex. This as well contributes to the antipyretic effect of paracetamol. The intermediate compound AM404 stimulates the cannabinoid receptors in the brain, and it stimulates the production of cannabinoid. This is why some patients who are consuming paracetamol, they feel euphoria and relaxation apart from the analgesic effect of paracetamol. This effect is highly sensitive in the sense that it totally depends upon the pharmacogenetics of the individual. And the intermediate compound AM404 can affect opioid system in the brain as well. When it interacts with the mu and kappa receptors of the opioid system, this produces a synergy between the opioid system as well as the serotonin system. This activates the pharmacological effect of paracetamol. So ultimately, it has got an antipyretic effect, anti-pain effect, but it does not have a anti-inflammatory effect. Coming to the mechanism of action of tramadol, tramadol exists as two enantiomers, that is D enantiomer and the L enantiomer. D enantiomer inhibits the reuptake of serotonin, and L enantiomer inhibits the reuptake of norepinephrine. So these drugs process the pain in the spinal cord as well as they take part in the descending pathways in the brain. So by acting on the spinal cord and as well as on the brain, they inhibit the pain. So when you combine paracetamol and tramadol, they have different pharmacokinetics. The pharmacokinetics of paracetamol and tramadol are different. So they can be given in acute as well as chronic pain. And when they are combined, the extent to which the severity of pain decreases is more, and the duration of pain relief is also more. So that is why paracetamol as well as tramadol is combined. Coming to paracetamol, the chemical name of paracetamol is para-acetyl aminophenol. It is called as paracetamol in UK and India, and it is called as acetaminophen in USA, Japan, and Canada. But they refer to only one chemical. And one more important point about paracetamol is that during pregnancy, this can be given for moderate to mild pain. Thank you.